my dad was my inspiration. You know, he was an oncologist.
My father is a physician.
My father-in-law was a physician.
I would sometimes go to the hospital with my father.
Maybe it's even been studied, I don't know, but I'm also the firstborn. You know, and the firstborn of a doctor, like I think they have like a 1 in 3 chance of becoming a physician or going into the healthcare field themselves. So yeah, it's not unusual.
I wanted to be able to have the feeling that I was doing something important and that I was helping people, and I wanted it also to be challenging and continually interesting for me.
It didn't look like such a bad way to spend your life.
The biggest change recently has been the shift from inpatient to outpatient medicine. Emerson's invested in building the outpatient arena. We have a number of different specialists, and primary care is growing as well.
We're seeing people sooner. We're identifying patients who could receive lytic therapy faster. And you know, we have, with the lytic therapy, we have an intervention that we didn't used to have 20 years ago. I've seen it help quite a number of patients that came in with a pretty big deficit from a stroke.
There seems to be a recent emphasis with breaking down the barriers between the disciplines and considering patients' care to be based someplace, for them to have a medical home, and for all of us who are caring for them to feel like we're part of that medical home and communicating with one another across disciplines. And that I like a lot.
I came to Emerson after over 20 years somewhere else. I only came here because I knew it was a good place. And what I found in my 10 years has been that it's an even better place than I thought. I really think that everyone here at Emerson cares about the patients first, and that makes all the difference in the world.
I enjoy the feel of the community hospital. I enjoy the relationship I have with my patients and with the other doctors here. The most rewarding part of being a physician is what is highlighted here at Emerson, which is the direct access to patient care and patients having direct access to their doctors.
I think Emerson's given us a great opportunity. I think it gives us physicians a great opportunity to grow, learn. It enriches us in different ways. So that's been wonderful.
The other thing that I would say is that this place is embedded in its community, and you really feel like you're working in a place that you belong in. Both in terms of the people that I work with living around here, and they're doing their work partly because it's improving the place that they live and the world that they're in day by day.
My first grandchild was just born here in last November, so she'll be a year old, and that's one of the places I'm going to go as soon as I'm done with you. Let's go see her. My daughter was moving from California, and to have her baby back here in Massachusetts, and I made sure that I had it all arranged. I can't say enough about how well she was cared for.
Well, I have a lot of faith in Emerson Hospital. In fact, last year when my dad had a complicated gallbladder surgery, he came to Emerson Hospital. My father got sick in Reading, Pennsylvania, and when he went to the local hospital, he was seen by a general surgeon. But the surgeon went to school with Dr. Andrea Vezzaniti, so my dad felt very comfortable coming up here to Emerson. Dad did extremely well, and he was very happy. All the nurses were wonderful, and the care he received at Emerson was outstanding.
Gee, everybody that helps us take care of patients, I'm grateful to be working with them, and I'm grateful for all their help, because I know that every day they work as hard as I do in the department.